Parents are often concerned about trialling a medication, and it can be quite a big step. And there is a small amount of evidence that some other treatments may be somewhat beneficial. The most commonly asked about would be the omega fatty acids, fish oils, and there are a number of trials of them, and it seems overall that there may be a mild effect on symptoms. And so if parents are wishing to trial those approaches in the first instance, we would think that's fine, and we suggest that that's monitored with rating scales to determine the effect, to see whether it's worthwhile or not, and reserve medication for later on if need be. There's some concern about some of those trials in that the trials that found the biggest effect tend to be those trials where the person that gave it saw the effect and teachers found less effect, or where teachers had given the medication occasionally, parents had found less effect. So there's a little bit of a question about how blind the raters were, but there's no harm in that at all. Some people ask about micronutrients. So Julia Ruckledge, professor at Canterbury University, has been engaged in two big trials of ADHD, one in children and adolescents and the other one in adulthood. And they seem to exert some effects in that the clinicians rating how people went in the trials found that 40 to 50% of the young people or adults were improved, much improved, or very much improved. But if you look at the ADHD aspects themselves, it's less clear that it's that which has an impact. There was a positive effect in the adult trial, but not in the child trial. And some other things did seem to improve, things like emotional regulation, which is sometimes a really challenging feature, and behavioural issues. And the micronutrient trial, there's been another study in the States which showed much the same findings. So there's something in it, but for core ADHD symptoms, my opinion is it's probably less useful than some of the medication options which have a stronger effect.